Dr. Leone, tell me a little bit about yourself.
I'm a board-certified orthopedic surgeon. I came here to Buffalo in 1998, and I've been here now for approximately 16 years in private practice, doing spine surgery and orthopedic spine surgery.
Talk to me a little bit about yourself. What kind of fitness do you like to maintain, and what do you work on for yourself?
I've always been into bodybuilding. I started lifting weights when I was in med school back in the early 90s, and started getting into it more intensely after I tore my Achilles tendon. I was forced to go on a diet because for 2 months I wasn't allowed to put any weight on it. And I realized just how easy it was, if you maintained a proper diet, to drop body fat significantly and have more definition.
And in the process of doing this makeover with you and working on your fitness, we put you on a schedule. How has being on an appointment-based schedule helped your schedule get your workouts in?
I do better by coming in the morning, as I've done. I think that when I get the workout in the morning, usually at 7 a.m., at least for me, the office hasn't gotten crazy and I'm capable of going ahead, getting my workout done. And it's actually a good feeling because in the afternoon, if things get hectic, at least I know that my workout is done. And it does make you have more energy.
I know you see a lot of patients that need spinal surgery. How can being strong, working the body, prevent against possible injuries even before they happen?
Well, actually, that's a huge thing. That's one of the reasons I feel that it's important, at least for me, to try to look reasonably good and maintain a decent physique. And body habitus it's very difficult to convince your patients that they should stay in good shape to protect their back if you're not in good shape. I don't think people realize how much of an effect it can have on you when you're not conditioned properly. It makes you more susceptible to injuries, and if you do get injured, it makes it much more difficult to recover from the injury.
Before we started this process, I think you were telling me that you like soda pop a lot. How have you curbed that, and how have you gotten around that?
Being Italian, I'm cursed with the desire for sweets and in particular carbohydrate-ridden foods, so that was probably the most difficult. And some people liken carbohydrate withdrawal to withdrawal from drugs, and to a certain degree that's probably true because the high that you get from sugar it is very good. However, while it might feel good, what it does to your insulin levels and to your body overall is actually very bad. So the first week or so was a little unpleasant, perhaps, certainly not undoable, to get that craving out of your system. But once that was gone, it was actually very simple.
Here are his results. Dropped 38 pounds on the scale, 42 pounds of fat, gained 5 pounds of muscle, strength improved 32%, and decreased his triglycerides and cholesterol. What would you tell somebody right now who's struggling, who's looking to get started? What tip would you give them?
I think like anything else, whether it's something like this or making other changes in your life, a change in lifestyle, you have to find something that motivates you. If you're not going to lose weight or get into better shape for yourself, for your own personal self-esteem and image, you have to start thinking about your health. I just recently turned the big 5-0, and now when I get these lab results, when I go to the doctors, these numbers are a little more meaningful as you get older. So I think that you have to try to look at the big picture in the long term and think about the benefits that it's going to have.